So I'm Marrie Hillard. I'm a social worker at St. Mary's in the emergency department. I've been there 11 years. I primarily do psychiatric evaluations there. So I wasn't going to speak. I don't have anything really prepared, but Michelle will convince me. I would like to echo Michelle's comments in that I think transformation makes all of us nervous and excited at the same time. We know that there needs to be changes to the mental health system that we have here in Colorado. I also would hope that those of us that are doing this type of work every single day and have been for many, many years can be involved in any changes that are made. I think when systems change, oftentimes it feels like those of us doing the work are left out of the mix. And rules or policies are imposed that makes no sense for the type of work that we do and the types of collaborations we do have and the parts of the system that do work well, which isn't all of it by any means, but there are things that work. We have a pretty solid community in Mesa County with collaborations, with teams, with people that come together to accomplish difficult tasks, to staff individual patients, to come up with individualized plans that can help a member that's struggling, that all of us that are at loss as to how to help. So yeah, and I also want to comment what Michelle said about don't medicalize this too much, because human connection and communities and upstream thinking, all of those things can help, oftentimes much more than all the stuff we have to do after the fact to deal with trauma versus prevent trauma in the first place. So as much as we can focus on upstream interventions, community partnerships, relationships, human connection, and involving those of us, doing the groundwork every single day to improve the system, to make it better, but to make sure that we're still working together and not bringing in outside agencies. We've had a recent very big shift in the mental health system here. And Michelle and I were just talking on the break. The ER has been impacted. We've seen a huge number of patients now coming to the ER that weren't coming prior, which of course is the most expensive place to get care. But we've also seen a huge number of people not getting help at all because they feel like the system's broken, they don't understand how to access services, they have fear surrounding the change, and so they're just not getting care at all, which I think is much more worrisome than utilizing the old system and building in supports to make that better, instead of what we've done is this complete shift where clients get all sorts of different answers. They call the recommended hotline. I had an officer last night that was told, oh, drive to Montrose, that's where you can get help. The model's supposed to be, there's a mobile evaluation available, but that's not the message that clients are getting when they call the state hotline. So yeah, I would hope that before we change it all up again, think about what's working and add structure to that versus undoing. So those are my comments. Thank you.
Thank you. Appreciate that.